Centromere near the end of the chromosome. A. Acrocentric. B. Metacentric. C. Submetacentric. D. Telocentric. Now the different centromere position is that we all know that each chromosome has two arms labeled as P. P is the shorter arm and Q is the longer arm. P arm means petite, meaning small, and Q arm is Q because it follows the alphabet P. Q. Now metacentric means a chromosome is metacentric if its two arms are roughly equal in length. So metacentric means both the arms are equal in length. Then coming to acrocentric. What is acrocentric? Acrocentric chromosome, if the P arm is so short that it is hard to observe but still present, then the chromosome is acrocentric. P arm is so short that it is hard to observe but still it is present. So it is acrocentric. So let us now look at what is the correct option here. The correct option here is A, acrocentric. So centromere near the end of the chromosome is acrocentric. Now let us move to the next question. Nerve supply of circumvallate papillae is A, hypoglossal nerve, B, glossopharyngeal nerve, C, lingual nerve, and D, chorda tympani. Now circumvallate papillae is the largest papillae near the base of the dorsal aspect of tongue. So the circumvallate papillae is supplied by which nerve? Glossopharyngeal nerve. Now let us look what the correct option here is. The correct option here is B, glossopharyngeal nerve. Coming to the next question. Contents of adductor canal are all except A, femoral artery, B, popliteal artery, C, nerve to vastus medialis, and D, saphenous nerve. So the correct option here is B, popliteal artery. The adductor canal is a aponeurotic canal in the middle third of thigh. It is a aponeurotic canal, also called as subsartorial canal or Hunter's canal. It is in the middle third of thigh, extending from the femoral triangle to the opening in the adductor magnus. The adductor hiatus contains femoral artery, femoral vein, and saphenous nerve. So the correct option here is B, the popliteal artery. Constriction of esophagus are all except A, arch of aorta, B, left main bronchus, C, left atrium, D, diaphragm. Now esophagus is a fibromuscular tube. It is about 25 cm long in adult. It extends from the lower end of pharynx, that is C6, to the cardiac end of stomach. Lower end of pharynx to cardiac end of stomach, T11. It runs vertically but inclines to left from its origin to thoracic inlet and again from T7 to esophageal opening in the diaphragm. So it shows three normal constrictions. Number 1, at the pharyngoesophageal junction C6, which is 15 cm from the upper incisors. Second is at the crossing of arch of aorta and left main bronchus, that is T4, 25 cm from upper incisors. And third constriction is when it pierces the diaphragm at T10, that is 40 cm from upper incisor. So the correct option here is C, left atrium. Now axis artery of lower limb is derived from A, natal artery, B, first lumbar intersegmental artery, C, fifth lumbar intersegmental artery, and D, sacral artery. During fetal life, what happens? Each limb is supplied by axis artery, that is derived from the intersegmental arteries. The axis artery runs along the central axis of limb. Upper limb axis artery is derived from the 7th cervical intersegmental artery. The derivatives of upper limb axis artery are axillary artery, brachial artery, anterior interosseous artery, and deep palmar arch. Now coming to lower limb axis artery. Lower limb axis artery is derived from the 5th lumbar intersegmental artery. From the lower limb axis artery, the derivatives are inferior gluteal artery, arteria nervi ischiadici, popliteal artery above popliteus, and lower part of peroneal artery and some parts of plantar arch. So the correct option here is C, 5th lumbar intersegmental artery.